Be on our Prophet Muhammad sallallahu alaihi wasallam, family and his companions. Respected Professor Datuk Dr. Asma Ismail, Ibnu Sina Chair of IIUM. Assalamualaikum, and also to the Deans, Directors, Senior Officers of IIUM, and all participants from the Gombak, Kuantan, and Pagoh campuses. Assalamualaikum warahmatullahi ta'ala wabarakatuh, and a very good morning, ladies and gentlemen, brothers and sisters. Before we begin, let's all recite the Surah Al-Fatiha. So I would like to wish a very warm welcome to everyone here to the talk entitled Commercialization of R&D, the Malaysian Experience, by our distinguished speaker, Professor Datuk Dr. Asma Ismail. Okay. We always hear about commercialization experience from outside. Okay. But we have a real champion here in Malaysia that we must learn how commercialization is done through the Malaysian experience. Therefore, it is a great honor for me to introduce our speaker today. Okay, so Prof. Datuk Dr. Asma Ismail is a woman of many firsts. Okay, so to the young woman here, this is inspiring for all of us. She was the first female Vice Chancellor of University Science Islam Malaysia, USIM, in 2012, and the first female Vice Chancellor of University Science Malaysia from 2016 to 2019, making her the first woman to be appointed twice as the Vice Chancellor of a public university. She has served as the country's first female Director General of Higher Education from 2014 to 2016 and is currently the first female President of Academy of Science Malaysia from 2016 to 2022. She also served as the first female to be chairperson of the Malaysian Qualification Agency, MQA, from 1st January 2019 to 1st December 2021. Her current position now is as Ibnu Sina Chair for Medicine at IIUM from 2020 to 2022. She also served as an honorary professor at the Institute of Research in Molecular Medicine, USM, and Associate Research Fellow at the Biotech Research Institute, University of Malaysia, Sabah. Okay, so Prof. Datuk Asma is everywhere here. Her background, credentials is inspiring to all of us. However, this comes from her educational background, vast experience, which her educational background is having a Bachelor's of Science in Biology from the University of Nevada, USA, MA Microbiology from Indiana University, USA, and a PhD in Cellular and Molecular Biology from UNR. Prof. Asma also has initiated scientific discoveries that have led to attainment of 14 patents and commercialization of the rapid diagnostic test, the trifod called, Trifidot, which has advocated by WHO. As a researcher, she has published 131 papers, received more than 213 awards and recognitions, presented more than 425 papers, including 376 invited talks, plenaries, and 48 keynotes at the national and also international level. Therefore, she was elected to the Academy of Science Malaysia 2003, Academy of Science for Developing World, was in 2010, Islamic World Academy of Science in 2016.
Some of the issues.
She was also elected as honorary member of Iranian Academy of Medical Science in 2017, and the following year as a member of College of Fellows, Keele University, as a governing advisory board member for Ritsumeikan at Asia Pacific University in Japan. In recognition of her leadership in lifelong learning in the Commonwealth, especially for women, okay, and her outstanding service to the advancement of higher education and science in Malaysia, she was conferred as an honorary fellow of the Commonwealth of Learning in September 2019 and honor scholar for IISA, Institute for Applied System Malaysia in Vienna, Austria in November 2019. Currently, She serves on the selection panel for the Merdeka Awards and the prestigious Rhodes Scholarship to select Malaysians to Oxford University. In 2020, she was selected to be a board member of Commonwealth Learning based in Vancouver, Canada. Her landmark contribution, especially to Malaysia's higher education system, include establishment of the prestigious National Academic Award Anugerah Akademik Negara, establishment of research universities in Malaysia, and also in co-helming the development and implementation of the Malaysian Education Blueprint Higher Education from 2013 to 2025. With regard to commercialization of R&D, I need to mention this because it's about commercialization, this talk. Some notable awards that she has won include Anugerah Saintis Muda Negara, Anugerah Inovasi Negara, and Anugerah Akademik Negara for commercialization. And she was the first to win this in Malaysia. She has won numerous gold medals at exhibitions that you can't count it anymore. Okay, cannot count it anymore. So without further ado, I would like to invite our respected speaker today, Professor Datuk Dr. Asma Ismail, to deliver her talk. Boleh tolong set up? Ya.
Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Salam sejahtera. Selamat pagi. Morning, everybody. Those who are here physically in the hall and those who are online. I guess this is the new norm that whatever that is being discussed at UIA or IIUM can also be heard by everybody around Malaysia, even around the world, that whoever got this link. But anyway, thank you, Dr. Amani, for the kind introduction. So this is a Friday. There's probably a lot of things that we need to discuss. And let me get on to the topic, which is commercialization of R&D, the Malaysian experience. And this is the, showing the picture of Typidot, the diagnostic test, rapid diagnostic test that was developed at USM before. And this is the scope of what I would like to discuss this morning about K-economy and the state of R&D in Malaysia. Why are we not there yet? What are the issues and challenges of performing R&D towards commercialization, and sharing with you some of USM's experience. Let me begin by saying that in the knowledge-based economy, knowledge and innovation are the driving force of business and economic development of the country. And business and economic development are always about survival and about sustainability. So for survival, we need to continuously have new innovative products. If anything, it is not a very new or newly original product. Minimum, it should be at least value add to the existing products. And for sustainability, we need to have new technologies or new enablers that will result in innovations, new innovations. So for the country to survive in the new economy, it's therefore imperative that R&D, commercialization of R&D products are the national agenda of the country. Therefore, there's a need now for all of us researchers to undergo translational research that can create impact to society and industry. I borrowed this slide from Tan Sri Zul, basically showing what are the stages of economy in Asia. We are supposed to be resource-driven before, to investment-driven economy, and finally now with innovation-driven economy. While we are at the state of innovation-driven economy, the world does not wait for Malaysia or even for Southeast Asia. We have already gone through, the world has already gone through from knowledge-based economy to now bio-green economy. So if we go forward, we should be now going to bio-green economy and all the way now to humanization economy, where wisdom, moral, spiritual now comes into being, and people are now talking about outcome or impact to humanity, which is key result indicator, rather than output of knowledge, which is KPI. So it's no longer about performance, it's now about key results, having the impact in the outcome. And basically, if you're talking about humanization economy, we are now moving now to, instead of saying profit-based research, we are moving to values-based research, right? Ada nilai-nilai murni coming out from the research outcome. And basically, in short, is putting soul into R&D. And if you look at what are the factors that will now drive economic success, we're talking about patents, advanced research, venture cap, university graduates and PhDs, of course, how we can distribute the product by air, rail, or sea hubs. You find that 3 out of the 5 are actually located in the university. That means having the patents, doing the advanced research, and having the university graduates and PhDs. So all this asset that is needed by the country to drive K economy or knowledge-based economy are basically located in universities. So by right, the university should now be the test bed of innovation. So let's see whether that really happens. So that is why also the role, and this is also aligned to the roles and expectation of universities in the 21st century. Before, I think when we were in the university before, we were just asked to generate knowledge, right? Which is to do research, and then we disseminate knowledge. That means you publish, you generate, then you disseminate, and dissemination is two ways. One, you publish, you write books, you write articles, or you train students as your graduate students. So that disseminating. But now, as a lecturer, you're supposed to now to translate knowledge, right? And to create value out of the knowledge that you have generated. And this time around, to test that particular knowledge and create impact through real world experience, not experience from your lab, but actually moving into the community. So require community participation. So that now the universities are asked to be now the engine of growth for nation via commercialization of R&D products and knowledge-based enterprises. And when you train students, you are training them to be innovators of tomorrow. So the responsibility of being a lecturer now is enhanced. Yeah? So, and when you design curriculum, you're supposed to design curriculum that create entrepreneurs to participate in startups, and or to design supaya the curriculum creates graduates that are job creators rather than job seekers, and but more importantly, put values infused into these graduates so that they care also about humanity and be good citizens of the country and a nation builder. Whatever it is, you need to empower talents now to be action oriented. So this is what in UIA, you have sympathy, you have empathy, but the third word is compassion. You can just sympathize and say, yeah, I sympathize. You can empathize by putting yourself and say, oh yes, I sympathize and I empathize, but still you didn't do anything about it. But if you have compassion, then it's action oriented. You sympathize, you empathize, and you want to do something about it. And this is the calling now for especially lecturers from UIA, the compassion part, to actually do something about it than just sitting at the chair. So bottom line, this is where we are expected. Therefore, the movement of knowledge now expectation from universities is from research to development to commercialization to the setting up of knowledge-based enterprises, or it can be social enterprises, but to bring that one more step to the community engagement, by community to bring community participation so that you can help now humanity. So in essence, if that is the case, where are the researchers in the country? This is from Academy of Science. And the researchers in the country, you look at Malaysia, the red area is where majority are in the IHLs, in the universities, right? And the blue area, which is where the members of the industry, only 21.9% are in the industry, and in the government 6.63%, right? But if you look at countries that is innovative, that is creative, that is moving knowledge-based economy, where are the researchers? The researchers are in the blue, right? Majority are in the industry, and that is why we are not moving innovation, because a lot of these people who do research in this country is located in the university. And until and unless the paradigm shift happen among lecturers in the university, we will be stuck the way we are today. That means even the lecturer doesn't have the mindset to say, I want to do translational, I want to be compassionate. It doesn't do that. So until we keep on thinking the way it is, then nothing will change in this country. So we need to have a new paradigm. In essence, when you talk about knowledge for successful new economy. You have to go from research to development, commercialization to setting up of enterprises, or can be social enterprise or profit enterprise. But bottom line, you should see a smooth flow or continuous flow from RDCE, right? But what is happening? In reality, you have very big R. Research, research, research. Minta grant makan nak gila. So research, research, right? But when it comes to development, very few start to do that. And then when it comes to commercialization, even fewer starts to do that. And the setting up of industry, new industry, consolidating existing industry, even very few. So bottom line is that only 5% of R&D from IPTA is commercialized. 5% after the billions of dollars that the government spend on the research, only 5% is commercialized. And even then, how many actually start new industries, consolidate industry, create GDP for the country? That is something we need to question, right? So the question then is, why are we not there yet? Okay, see, I guess we need to discuss today what are the issues and challenges faced by universities, why we keep on the way we are. So this is what I mean by moving from brains or idea to business, and from business to humanity. So a lot of you translate that from laboratory to industry to society. So it's easier, but I call it brains to business to humanity, right? So what are the issues and challenges? First, I will discuss, these are the issues that I'm going to discuss today regarding what you guys face probably at the universities, right? First of all, at the national level, do we have political will? If we don't have political will, you can forget about R&D being there as a national agenda. Dua, is leadership of the university driving innovation? Because if in the university is not driving innovation, you're also not moving anywhere. So are the researchers, if the political will is there, leadership is moving, are the researchers' mindset also changing and saying, yeah, I want to be compassionate, I want to do something about it? If it's not happening, then paradigm shift has not occurred. That means acculturation of R&D has not occurred. And then the act of performing the research towards commercialization itself. So this is also an issue that you need to go through. That one is the act. The other one is to go through the gate of commercialization. And then after you have gone through the gate, what else can you do to help the university? So these are some of the things that I would like to discuss today. First question, do we have the political will? Ladies and gentlemen, despite the low innovation percentage, the government still believes in the researchers. Every year, the money is enhanced, right? So we now see that the red is basic research, the blue is applied research, the green is experimental development. The government still continue to pump money for Malaysians as a national R&D, right? That's why the grants constantly is there. MOHE grants, MOA grants, Ministry of Health grants, MOH grants. So we have all these ministries, they all have grants, right? So bottom line is that the only problem is the allocation of the grant is not quite there in order to move translational research. So if you look at Malaysia, a majority of the grant, the whole Malaysia, this is not just FRGS, please open your mind now. This slide is for all the billions that is now pumped to Malaysia for R&D, right? So that means a combination of all ministries and plans. So you find that for Malaysia, 28% is moving fundamental, which is basically located at MOHE, right? Where we are, the universities. Then 56% is moving applied. So if you combine 56 plus 28, everything is dying at prototype. You understand? So it doesn't go beyond prototype, right? It doesn't go beyond prototype, because when it wants to go beyond prototype, it's only 14.6% that is now allocated for experimental development. So, but if you compare Thailand, which is more innovative than Malaysia, you have now at least 51% of the grant allocation is moving to translational research. Do you understand what I'm trying to say? When the allocation is not there, it's very difficult even for the companies to now license the product from you and then actually move that into a proper commercialization at the industry level. The number of researcher industry is also very low, right? So where are we? We have too many lecturers, researchers in the university, and then the grant allocation to move translational is also not enough. So we need to change. So inshallah, we have already informed in RKM 12, we would like to now shift this. This one, do not get upset. There will still be fundamental, there will still be applied, but we are enhancing the green part, the translational part now up to 50%. So there'll be 50% from fundamental and applied, and another 50% for translational. I mean, that is what is proposed, but whether this happen or not in RMK 12, we wait and see. But the beauty of researchers, if you ask, RMK 12 ni ada duit lagi ke for research? If you ask that question, please, we are always looking for policy. Policy is there, is punca kuasa for R&D to continue. And this is the new policy, Shared Vision, Prosperity Vision 2030, right? So shared prosperity vision, setakat ni nobody has changed this thing yet. So bottom line is on. So what does it say? It says now, the production of knowledge-based economy that is high value, that must now undergo community participation. This is what I'm talking about, impact research now, not just up to the university, but bringing it now for community participation. And what is that research supposed to do? Address economic disparities to reduce the inequity divide, right? That is the answer to sustainability. That's why if you now UIA, you are the best university for sustainability, this should be sok sway for UIA lah. So basically it should be your bread and butter to actually be able to do this kind of job. And basically now is to make Malaysia united, prosperous, dignified, but to also be an economic center of Malaysia. So if we are going to do that, our product must also enter the global market. So therefore, to enter the global market, of course, the quality needs to be there. If there's no quality, they will not bring in the product into the market. Yeah. So in short, it doesn't matter whether you are doing fundamental, curiosity-driven, or you are people-driven, that means people-focused, or you are industry-focused, because there is a melting pot of different disciplines in UIA or even in any of the universities. It's not a one-line fits all, you know, one size fits all for everybody. So different people have different needs for them to do research. So let them be. But whatever it is, it should converge to transform. Some other you have serendipity or curiosity-based research, you want to do fundamental query, or people-driven or industry-driven, you need to be able to transform socio-economic well-being. That is what shared prosperity vision is all about. So to bring it so that you now become a nation builder, right? So that's why if you are moving now, the best part is to move SDG, because that is what the world is now needs. So nothing fancy about it, but is to move SDG, yeah? So Sustainable Development Goals. So the 17 SDGs are there. So what do? You just have to make things to be available. If it's available for the first time, this is novelty. This is where you patent. If it's available, but you adopt and you adapt the technology, it can still be patent. It's under utility patent, but it's not original, right? So, but whatever you do, make it affordable to reduce the inequity divide. But even if you have it available and it is affordable, but you need electricity to use, and you go into a place that has no electricity or internet, it's useless. That means your experimental design, you didn't think it carefully. You only think about people who have electricity. So that means your innovation now is useless for the people who have no electricity, right? So accessibility, maybe now you should think about solar. So your innovation should now be using solar. Then doesn't matter where you want to go. You can be battery, it can be solar. You understand that? So your innovation, you start thinking about this. Once this is guiding you to make it available, to make it affordable, to make it also accessible. Because kalau available and affordable but not accessible, nobody can use also. So, but even though it is available, affordable, accessible, is it appropriate to the culture of the people, right? You do something that has porcine, finish. The entire Muslim world will not buy your product. You make a vaccine that has porcine base, for sure, a Muslim world will not take that product. You see, you have to be thinking. So how now do you make it appropriate for everybody? So if it's halal, it goes into anywhere, right? So then of quality. Quality means it must be accredited you have to perform in accredited lab. If the lab is not accredited, how can you end up with a quality product? And without a quality product, without ISO 17025, 15189, whatever you're doing, GMP, if you don't have all those things, the product cannot go into the market. So that means we forget about going to the global Asia market, right? So, and for universities that is successful to do this, Sharia compliant would be something that is a niche for Malaysia, if not just for IIUM, for Malaysia as well, Sharia compliant, because this will be a niche area for RMK12 if you want to move, yeah? So basically, if you talk about sustainability, it should now be able to drive the agenda of shared prosperity vision or anything else in the world. So the next question, is leadership of the university driving innovation, right? Having an innovation ecosystem is a very important agenda. If the innovation ecosystem, I never say innovation alone, ecosystem, the whole thing, the HR, the RMC, the whole thinking, the policy, the IP policy, all that need to be there. And the officers needed, the officer and the officers needed to move and drive innovation need to be established in the university or in driving innovation, right? Like, so leadership in the university must have the innovation ecosystem in place, and to have innovation is the entire value chain. That means you need a technology transfer office, right? So if you don't have the technology transfer office, is the office that has lawyers that will deal with the IP, etc. But if you don't have a technology transfer office, you need, however, an innovation office. So you have innovation office that combine technology transfer and innovation. That means a group of people who will now drive others to want to commercialize, like what Dr. Amani is, right? So, and then on top of that, because in IPTA, it's called bribery if we bring in consultancy direct to our bank account, it's called bribery. It has to go through the commercial arm of the university. So all consultancies, including the commercialization of our product, must go through the corporate arm of the university, which is the holdings, right? So do you have that in place? And then tak guna ada all these things if your IP policy is not there. So you also need the IP policy to be there, and the IP policy must be comprehensive. It must cover the support staff if they innovate. It must cover especially the academic staff. It must address the postgraduate. What rights do the postgraduate have when they are performing research together with the academic staff? And then what right do the undergraduate have if they are performing elective project, but that elective project is a wow thingy that has also can result in startups. So there is a lot of things that the IP must address, so that it's very clear from T0, and we do not end up fighting and hating each other because of money. So it has happened. So the next question obviously is, are our researchers innovation driven to support K economy? So this I need to tell point blank. In the new economy, a discovery, whatever fantastic, wow thingy, eureka that you have is of no value to anybody unless it can benefit the public. All right. So therefore, you need to show impact with demonstrable evidence beyond academia. And that's why even if you look at the Nobel laureate will not get the Nobel laureate until their punya discovery has been translated by somebody somewhere to now say that it has benefited the public. Only then do you get the Nobel laureate, right? Prestigious awards like Third World Academy, to be a Third World Academy, or even Mahathir Science Award, or even Tokoh Akademik Negara, all that must show demonstrable impact first, right? So a lot of people are confused. They think that if they win gold medals, they go to all this exhibition, they publish in Q1, Q2, and then they have a product, and then they win in some exhibition, they say, oh, then I deserve promotion. Hello, think again. You have not done anything yet. So winning gold medals at one is nothing, all right? So basically, kenaikan pangkat at the university also does not take care of your gold medals, right? You have to do that as part and parcel of convincing your peers in terms of innovation, but it is not part and parcel of your kenaikan pangkat, all right? And discoveries and products cannot reach the public unless this is commercialized. You gotta make your first dollar. If you don't make that first dollar, it is not yet an innovation. It is just an invention. Remember that. So if you want, because what I'm talking today is not invention economy, I'm talking innovation economy. So that means the product must be commercialized, it must make its first dollar. That's how, kalau you kata you patent, you don't get anything in USM, at least until you have made that first dollar, baru the university bagi recognition. Okay, so, and when you say commercialization, many people may be upset, you know, because they say, oh, knowledge is for public good, tak payahlah commercialize. Hello, you can commercialize for profit or you can commercialize for non-profit. Now, Y2 is up to you. What do you think? What do you want to do? If you want to do it for profit, you can move industry, but you can also do it as a social enterprise, not for profit. It's up to you, but you can also combine both. When the business model is that you make the profit, but the profit is siphoned to help the poor. So you undergo both. So there are many kinds of business models like this, right? So Robin Hood, you rob the rich to help the poor, you know, but it depends on your business model, right? And the research performed from now on, it's got to be client-based. That means people focus rather than researcher-based. It's not about what you think, it's about what the target audience, the one who wants your product, whether they want it or not. So therefore, from now on, if you want to create impact, it's got to be priority driven and not researcher driven. Okay. And if you want to do that, you've got to work with the end in mind, what you want to do, and then work backwards as far as research is concerned. So the experimental design, today I'm teaching you about experimental design, how you design your experiment from T0 to undergo research for commercialization, right? And it has to go from Z to A rather than A to Z. When you come back from your PhD, everybody is teaching you introduction, materials and method, methodology, results, discussion, right? A to Z. But when you want to do research for commercialization, it's actually Z to A. You have to work backwards. I will show you how to do this. So this is what I mean by, I think it's time for change. Because if you don't have this new paradigm and we continue to do from A to Z, until forever, Malaysia will not see the impact. All the cekiah on the street will not be able to see that knowledge that you have generated and disseminated, whether it is of importance for public good or not. So it has not benefited the public yet. So we need a new paradigm. And to do that, you have to now combine fundamental and applied, right? So this is where, don't say to yourself, I'm a fundamental. And then the other person, like, I'm an applied. Essentially, to move the innovation value chain, you need the combination of the fundamental and the applied. That's why I say it's convergence of knowledge. It is also working together. It is collaboration. This is the new way forward. It's no longer about you and you, kita jaga kita, you know, you and you doing your research for you, right? So basically, it's not benefiting anybody, right? And work, therefore, in a cluster or in a team of multidisciplinary, interdisciplinary, or transdisciplinary expert to provide a holistic solution, not from your angle. If you're an engineer, don't work with more engineers because you will come back with an engineering solution. We don't want an engineering solution. We want a solution for humanity. You understand? So it cannot be just, okay, you need the physicists, you need the social scientists, you need the humanities, you need them so that it is meant for a solution for humanity, not a solution from an engineering point of view. So there's something you need to look at also. And therefore, when you are working together, it's imperative that the research team is entrepreneurial minded. Not to become entrepreneur, but entrepreneur minded. Maknanya they always work with the end in mind, what you want to do, and then work backwards. So this I will teach you so that you understand. Entrepreneurial minded is required for all researchers, but not all of us are asked to be entrepreneurs. There's a difference there. We can all need to be entrepreneurial minded without having to become an entrepreneur. Entrepreneur is to go through the commercialization gate, but before that, we can always be having an entrepreneurial mindset. So you learn the concepts of entrepreneurship so that the product design, therefore, is commercially viable, and you have to choose the technology platform well. And when you do that, you have to think about high tech when you're doing the fundamental, but when you want to now innovate and produce the product for the public, it can be high touch. Maknanya the product may not be high tech anymore, right? So, and therefore, whatever you decide, because it takes you 3 years or more to produce a product, you must make sure that the product is not blasé by the time you are ready. You understand? 3 years from now, orang dah tak guna dah that product, baru you nak hasilkan that product. Useless. So you have to predict now what is the trend of technology 3 years from now. All right. So, and we need to be prepared years in advance so that the product we produce will always remain to be technologically competitive in the global market for profit or for social enterprise. And make sure, of course, that you can create a sustainable change to society and prepare today for tomorrow. Always, for social transformation, always we have R&D, and we say we develop the prototype, it will benefit A, B, C, D. Never sure yet whether it benefit or not, but it will benefit. This is expected result. Now no more, it's lame excuse. Now we'll have to say, show me that you have benefited the public. So that is the difference now, because this is now key result or impact, right? So R&D now, in RK 12, will now move to show impact socio-economic development or industry development. So you can pilih. If you're an engineer, you want to work for industry because it's expected. As engineering, you also need to solve and move the industry in the country. But it doesn't stop you from helping humanity. So and medicine, obviously, socio-economic development is your first, because the client are the people. So this is where, but medicine also in digital health or in precision medicine can also move the medical and health industry. So these are the things that you want to talk about. So now I want to discuss about performing research itself. That means you now, in listening to me, young researcher, medium, or whatever that is now interested to move for commercialization of R&D, how now should you be thinking, right? So if you are serious about research leading towards commercialization, you need to plan your experimental design from the beginning, not A to Z. Maknanya, when you get a product, then only you think about, where's the company who want to license my product? That is working A to Z. And that one will happen only by chance. This is not by design. So that is why 5% saja being commercialized. Because you never think from the beginning. In the experimental design, when you propose the grant itself, you should already be thinking like this. So the research approach is therefore from Z to A rather than going from A to Z, which is usually normally done. And when working from Z to A, you have to determine what is the final milestone. So at the end of the day, you do all these things for what? You have to ask for what? So what do you want to do? You want to make a drug? You want to make a vaccine? You want to make a kit? You want to produce a book? You want to produce a process? It can be a product or innovation, a process, a procedure. What is the end point of this, right? So what you want to make at the end of the day will determine when do you want to see this happening, right? So there's a lot of thinking here. I'm sure none of you think about like this. Do you want to see the product within your lifetime? Or do you want to see the product after your lifetime? There's a difference. If you want to see your product during your lifetime, you can drive the innovation. If you want to see the product after your lifetime, you take the chance. Maybe nobody give a hoot about your product and don't care. And your graduate students also don't care about your product, because as soon as they get their PhD or their master out, they are also having their own life. Why would they want to do your work? Nampak tak? So therefore, this will then determine the research problem that you want to solve. Right. So now I want to share with you how I started the journey by design. Of course, when I was doing it in my early career researcher or early career academic during my younger days, nobody taught me this. So now that I am in my sunset, whatever, so now I am sharing the knowledge so that now the young one can now do this by design, no longer by chance, what people like me had to go through, right? First thing before you start, check out what is relevant and seen as priority in the country. This is the problem. If you don't know anything at national level, you are finished. Because you work with katak bawah tempurung and you don't know what is happening and you think that what you're doing is great. It is not. So that's why you need external knowledge to come to the university and tell you what is happening up there, people, what is priority, what is not, what is niche area, what is not. so that you don't continue to work in area that people don't care about. So when you write your grant, you don't get the money because it doesn't fall under impact. You faham tak? When we have only 50 ringgit, why we want to give you money for doing something that is not of impact to the country, nor of priority to the country? Money from the national level is always for priority of the country. Remember that, right? So once you have what is the niche, then choose within that area itself, choose the correct research topic within the area itself. And when you choose the correct research topic, deep dive the topic, because now you need to be an expert in that area, right? Then only you write the grant, then only you undergo the R&D. When you write the grant, you get the money. Once you get what it takes, then you seek IP protection, and then you look for investors or whatever lah, and that's where the commercial arm is supposed to help you. And then you go through the commercialization gate for those of you who can and is determined to go from laboratory to industry to society. Okay. If you don't have this guide, it will be a long and bumpy ride. And a lot of the time, the researcher give up. So they never see pengkomersialan. They will give up because this is perseverance at its best, right? So remember that. Huh? So when I talk about being entrepreneurial minded, before I start anything, I ask, where is the future market? You're not going to enter a market, right? To be a global player. You want to be a nation builder, it's not meant for Malaysia. So by Malaysia ada GDP. So that's why it has to be exported. So you gotta be a global player, whether you like it or not. All right. So where is the future market? So if you look at Newsweek, Asia is rising. Until today, this is 2009, and until today, if you look at China and India, they are the one that will be now the new wave. It's no longer about the West. So therefore, performing research and innovation to address the needs of Asia is now a reality. And this is our ball game in our own backyard. Betul tak? This is addressing Asia. If we don't know Southeast Asia or Asia punya problem, we are finished. We should know because everything is on this side of the world now. So tomorrow's market is also this side of the world, no longer about the West. That is why the West is coming here. That is why they want to learn about trade. They want to learn about knowledge. They want to learn how finance is being done. They learn Islamic banking and finance. We teach them all without realizing that that's what is why they are here. Right? So RMK12. Any RMK will always be medical and healthcare, right? So you can't go wrong. If you continue with medicine, you can't go wrong, right? The next one will be smart technology, next generation engineering and smart manufacturing. So this will be, if the engineering team, this is where they want to be. And then smart cities and transport, and then food and water, agriculture and forestry, and of course in education and environmental and biodiversity. So we have all these areas, right? So I give you as an example, if you are now concentrating in 5G, 6G, basically that technology, how you read the 1010, this technology can move in a horizontal way. It can drive any of the 10 socio-economic drivers. If you are now in 5G, 6G, it can drive any of this. If you are now in blockchain, it can drive any of this, including education now, because we can no longer convocation. So now ledger system with blockchain, this is how now convos will be now, there's no need for physical convo, you can just by blockchain. So this is where the beauty of blockchain will be the biggest happening nanti. But if you want to concentrate on agriculture and forestry, you can now, if you're going down, tadi I tunjuk horizontal, if you're going down on agriculture and forestry, you can combine any of this technology to move agriculture and forestry. Or you can combine any of this technology to move medicine and healthcare. Right? So that's why you need to work together. So in order to do this, to drive impact, you have to have the integration of science, technology, humanities, and the arts working together to provide solutions to any of these socio-economic impact drivers. Okay, it's no longer in silo, right? So for me, of course, I choose to work in medical and healthcare. And this is why I share many times, but I don't think you all realize the beauty of Ahmad Zuhail's words to me when I was a young academic. This is a closed room discussion dengan fellows of academic science, because at that time, Tun Mahathir had called Ahmad Zuhail to be the science advisor for Malaysia. And Ahmad Zuhail is the last, dia dah meninggal arwah. So basically, that's it. We don't have any more Muslim scientists who are Nobel laureate. Right, they all died. So basically, advice from him, if we work on research topics that the West is not interested in, we will always be 20 years ahead. But if we work on topics that the West is interested in, we will always be 20 years behind. Do you understand or not? Right? Because the West is, what is on this part of the world? Poverty. WHO say if you make a vaccine, you have to sell it at USD $1. Which company in the world want to spend billions and at the end of the day, you can do it only for USD $1 or less? Come on, I'm not going to enter. It's not even a business plan. You faham that? So therefore, this is where we are. If we don't understand, because we don't have to produce things in USD, ours is in ringgit. So this is where now we can now lower the cost of production, understand the needs of what the poor is all about, and this is where we have the time. I say this because in US, I make a phone call, reagents, everything will come by 2 o'clock. Here, you can make any phone call. I challenge you, nothing will come today. 6 months also may not be there. 1 year also may not be there, or may not come at all. Right? So how you want to compete? That's why I say, if you work now on topics that the West is not interested in, you will be 20 years ahead because you have the time to be there. And that is Blue Ocean strategy before Blue Ocean book came out. So he was already addressing this to us. And so this is where, when we do this Blue Ocean, how can we ensure we are in the lead and ahead of our competitor? How do we make competitors irrelevant? And how can we create an impact to the nation and society? So this is where, for me, I focus on diseases of Southeast Asia, which the West is not interested in. Because there's no such disease in their country, right? So therefore, there's no competitor. So therefore, whatever I do is a gold mine. And that's how I can have 14 patents. Strategic thinking, right? So I work on typhoid, okay? Because I was in Kelantan. USM Medical is in Kelantan. So Kelantan is always fighting with Kedah to be the #1 for typhoid. So Kedah, Kelantan, Sabah, Sarawak. Pilih, what is the 4 country that will always be #1 for typhoid? Kalau today Kedah dapat #1, Kelantan will be #2 for typhoid. Those days, but not today, right? So basically in 1986, when I first got back from my PhD, there was a large number of typhoid cases in Kelantan. So I decided to work on typhoid. But this is the problem. The topic typhoid is too big. If you choose wrongly, your career is also busted. So I said, typhoid is too big. What is my expertise? I came back with medical biotech. I know my skill is medical biotech. So how can I use my skill to solve the problem of typhoid that can be done during my lifetime? Okay, and I need to choose the area well, because what the area I choose will shape my career. The problem with most young lecturer, they don't know. They touch base buat yang ni, then they touch base buat yang tu, they touch base buat this one. Caca marba. At the end of the day, you must plan your career well. You're going to be a professor of what? Not a professor of chop suey. Professor of what? This is where you need to plan. Somebody must guide you. You want to be a professor for what? So this you have to plan, yeah? So you need to plan so that it is now by design and it will create impact. So looking at typhoid itself, right? To choose which area. You can say, I want to understand the mechanism. Then I can do fundamental. I say, hey, hello. If I were to do fundamental, am I going to be getting a Nobel Prize? Think again. No way. With my alatan, I can never win any Nobel Prize. Compared in medicine, we have already studied. that there's no way. The only way Malaysia can win Nobel Prize now is Nobel Peace Prize, Nobel Prize for Literature, but never for medicine. To be a collaborator, okay lah, but to be the one to win for medicine, I don't think so, because we are not cutting edge. Right? Then do I want to make drugs for typhoid? Dah ada drug for typhoid. But if I want to make the drug, do I have 500 million to do the clinical trial? If I don't have 500 million USD, I can forget about it. So I decided I don't want to do the drug for typhoid. What about vaccine? Kan, the in thing. But typhoid pun also dah ada vaccine. And if look at vaccine, I'm not discouraging you, but the best you can do is find biomarker upon biomarker upon biomarker. Do we have the facilities in Malaysia? Not yet. Right? So when am I going to make the vaccine? Not during my lifetime lah, for sure. Right? Therefore, what's left? Diagnosis. Diagnosis is short term. You can get things done within your lifetime. You can find the biomarker, you can make the technology platform, you can create the diagnostic within. That's why if I want to attack COVID, I will still attack from diagnostic, not from the vaccine angle. All right. So I concentrated only because I can drive R, D, C, E on diagnostic during my lifetime, right? And once you decide on the product, then you have to determine, okay, you can buy diagnostic, I also can buy diagnostic, but my diagnostic will sell better than yours. Why? Because of the criteria of what I want that product to be. That is the decisive matter for commercialization of R&D, right? So, because at the end of the day, you have to, this is working from Z to A, you're thinking before you even write the grant. This is the thinking. First thing, regardless of when you want to see the final product, it must have the following characteristic. Number one, whatever you design and produce must create an impact. So to create an impact, you have to ask the question, orang nak ke? Right? If there's already diagnostic for typhoid, why would they want to use your diagnostic? So your solution has got to be better than what's there in the market. So if sometimes you don't need, but can the need be created? You never think about USB before. Suddenly now you cannot live without USB. You never think about the handphone before. Now you cannot live without the handphone. Sampai masuk toilet pun kena jawab phone. Right? So the need is now created. There was never need before, but the need is now created. Right? Can it be worldwide impact? Of course. If not, you cannot sell. And is it new? Is it innovative? Or is it just simply modified? So basically, if you focus on impact driven, it will result in originality. Macam saya kata tadi, make it available for the first time, accessible, affordable. You follow that, it will actually lead you to impact project that will be novel, right? So, and it will be technological competitiveness. So to create something like this, you need fundamental, you need technology to create the innovation. Next thing, the product must also have sales volume. You cannot be making a product for 10 people. You have to make a product like for typhoid. 41 million people suffer from typhoid every year. Maknanya sales volume will continue to multiply. For as long as for those who are in clinical, they do understand that typhoid is one of the diagnostic that needs to be done when you have fever more than 5 days. So when you have fever for 4 days, you akan check automatic. You akan check for dengue, you check typhoid, check. So every time you automatic check means the kit is being used. So for every case of typhoid, actually ada 10 kali ganda akan guna. So maknanya sales volume is very high. Nampak? So you have to think about that. This is what I mean by entrepreneurial mindset. So, and you have to understand the needs of the market and industry. So marketability of the product is very difficult to compete with similar type products produced by well-established companies. Like for example, orang dah buat Maggi, you nak keluar ramen, you nak keluar apa, everybody is competing. You go to the noodle section, you see how many noodles there are. Indomie lah, apalah, you know what I mean? So why would people want to buy yours? You see, so that's why it's better to compete with an original product because nobody has got that before, right? So it's easier to market original and create the niche for the product and make sure the product has a competitive price advantage. So don't go in with a product that is very high because we are helping to reduce the inequity divide. So it has to be now a more reasonable, affordable kind of product, right? And R&D therefore is needed to ensure that the technology platform used, it will lower the cost of production. So once you identify the diagnostic, all right, you now what the criteria. So this is what I read up, and WHO wants this kind of criteria to be there. So it has to be sensitive, specific, rapid, because current test is about 5 days. So if you now do something 3 hours is faster than 5 days. But by time goes, when I make the product for 3 hours, right now it's 15 minutes. So I have to make the product for 15 minutes now. So you change technology platform all the time to make the product to be technologically competitive. Simple, built-in control, economical, transported and stored without cold chain. If you make PCR finish, because PCR has to be transported in cold chain, you want to go to countries of the poor, mana ada cold chain? So you have to create now technology platform that no longer require cold chain, that everything is freeze-dried, you go to anywhere, when you reach the place you're going to do the product, koyak, add water, ready to go. Sama macam apa punya 3-in-1 coffee lah. Right? Shampoo, whatever, that's 3-in-1, 2-in-1. Kan? It can last for a long time. You go anywhere, put add hot water, ready. Maggi, everything is preserved, right? So that you pour, that concept can withstand no need for cold chain. So when you want to go to poor countries, no electricity, no internet, where you want to maintain cold chain? Even if it arrives without electricity, how are you going to have the fridge? So it's better you design already with the end in mind. That means who is the target audience who wants to buy your product? Okay? So, lebih elok. This is where in bahasa Kelantan, selalu dia kata, orang tak buat lagi. Apa kita nak buat ni, orang tak buat lagi. Right? This is where I said to the graduate students, if it was not done yet, then this is why we need to do it. Because then we will be novel, will be the first to now do this. Kalau kita ikut orang tak buat, dan kita ikut apa orang buat, then we will be a follower. Right? So now you want to write the grant. When you want to write the grant, this is a slide that is very, very important for anybody who is young. Because this is the slide that will guide you for business plan, ataupun you nak defend product, dalam to get gold medal or whatever. First thing, if you talk about typhoid, then you ask the question, what is the current scenario on typhoid? If you want to know what is the current scenario on typhoid, what do you read? Article or review paper? Which one do you read? Review paper lah, Mac. You read the review paper on typhoid because you have no time to baca the article. The article can be in many aspects, but a review paper will cover everything on typhoid. Etiology, pathogenesis, drugs, vaccine, diagnostic. It will cover everything. And which part of the review paper do you read? The last part. The way forward. Right? So when you read the review paper, read the last part. So for graduate students, if you're listening, read the last part. The last part will always be, where is the way forward for that particular area? Right? So if you do this, therefore you are following the trend lah. Okay? So what is the current scenario? What is wrong with the current scenario? So if I dah choose diagnostic, then my review article better be on diagnostic. And I want the last part is, where is the way forward for diagnostic for typhoid? Faham? Then you say, what is wrong with that way forward? What is wrong with the current scenario? Because this will now be the problem statement. When you are doing your PhD thesis or when you are writing the grant, this will be the problem statement. What is wrong with the current scenario? Of course, the other diagnostic, but what is wrong with the diagnostic of typhoid is taking 5 days to produce result. We want a faster one. So the solution is a rapid diagnostic test. Faham? So that will be your solution. Okay? If that is your solution, then you have to explain about your solution. Right? And how I explain the solution is the criteria that I use to make that solution.
and you got to be economical, you have to be rapid, sensitive, specific, can be transported without cold chain, the whole works. That is my solution. Why my solution is better than the existing solution, which require electricity, which needs cold chain. So I have answered all the things that orang tak buat lagi. Faham? Right? So explain your solution. What is the principle? Describe it, all right? And what kind of features? Itulah the product criteria tadi. And how do you plan to get the solution? This is your methodology. How do you plan to get that? That will be your methodology. Is there a competitor? So when you're asking for impact, of course you have to write whether there's already a competitor. And when you want to write in the justification for your problem statement, is there already a competitor in the market? And then why is the solution better than others around? So what is your criteria that will now ensure that this solution is going to be better than what is there in the market? Okay. So as I said, the same thinking can be done when you want to write books or you want to write grant, business plan, the whole works. Okay. This is exactly the slide that you can never find in any book. This comes from experience. How you want to do the design, the research methodology from Z to A. Okay. First of all, Z. That means you have to think about the end in mind. Hang nak buat apa? I already said, after I go through all that, I want to do things within my lifetime. If tomorrow you kata you nak buat vaksin, then you letaklah step 1 vaksin. Or step 1 the drug. Right? But I want to do a diagnostic. So if I want to do diagnostic, I said the product that I want to do must have impact, must have volume of sales, must have marketability. So I choose a diagnostic kit. Of course, they come to the next step. For what? I choose for typhoid because it can be any disease that you want, right? And why I choose for typhoid? Because it's a disease that is with local and global impact, right? And step 3, what kind of criteria do I need that product to be? So that's why I say it's rapid, sensitive, specific, okay? Step 4, what technology to choose to make it economical yet meeting global needs? So if I have been trained only in PCR and I come back now and I want to do PCR, probably it will not sell. Because I told you PCR must be done with the machine and it has to be now in a place in Bangladesh ke Pakistan ke yang tak ada electricity, then this PCR is worthless. So if there is none, that's why when I come back before from break, I decided in the lab, we need to make PCR that no longer use the machine. Again, pokok kat Kelantan ni orang tak buat lagi, right? But this is where we then say, if we use the DNA enzyme, we can now make the PCR without the need of the PCR machine. It can now be done at the room temperature. Okay, so, and then what do you need to make it sensitive or specific? Then you need a specific antigen. Where to find? That is where the literature review will tell you where is the best candidate to be a biomarker for diagnostic. So in this case, outer membrane. And how to find that specific antigen? That is where you perform the fundamental research. But in Z to A, you have here the innovation, which is actually using the technology platform to create the innovation. But in the beginning, in the last part, is the fundamental research. This is the thinking. But if you want to do now the writing, it will now be to find whatever, to find this. So this is specific objective 1. Specific objective 2 is to develop what? Diagnostic, drug, vaccine, to develop what? Using the method of what? PCR, non-PCR, what? And with the criteria of what? This is where you put the criteria. This will be specific objective 2. And specific objective 3 is to evaluate. Never write a grant that is specific objective and then develop and then diam. Everything that you develop must be evaluated. Baru they complete the grant proposal. Faham tak? So this is when you write is 1, 2, 3, but when you think is Z to E. So if, and by doing that, we found the specific antigen, which is a 50 kilodalton protein, and we developed typidol. Okay, so basically, after you develop, what's next, right? If you have a good product, what is next? You apply now for patent. Because when you want to commercialize, if your idea is not protected, the company also do not want it. because they have no exclusivity. Why should they want to take up and pay money for the product that has no exclusivity? So you have to patent. So Malaysian patent and international patent. So, and this system, this patenting system, I don't know where the legal officer is. Hopefully he is listening or she is listening for UIA. Because if this system is not smooth, then it's going to be a long time before you can get your patent come in. And basically you need to file. You can only get your patent minimum 5 years from now, but at least you file first. So when you file, that's when you publish. But if you publish before you file, you finish all the IP rights. So that lawyer better be telling you that. Because of your KPI, you tak sabar nak publish. But you forget that if you have intellectual property punya discovery, then you should be patent pending before you publish, right? So, and when you are publishing, please have patience with Malaysian IP lawyers because they are not biotech or science-based. So when I was filing my first patent before, I was saying, okay, I had this DNA, the protein, of course, 50 kilodalton protein, and then last time the lawyer listened to me, and then the lawyer said to me, excuse me, Prof, yes, what is DNA again? So you faham dah, after I dah cerita habis dah what this patent is going to be about, the lawyer doesn't understand what is DNA. So that was in the old times. I hope this is what happened because our universities are such that lawyers will always come from the arts, right? But tomorrow is about convergence of knowledge. If the lawyer cannot guide us in terms of claim, we finish. That's why the lawyers are necessary to understand, because when Malaysian patent kalah all the time because kita tak ada good guide to what is our claim. Orang boleh challenge kita boleh claim. And when you want to do something, you need the business people to say that your product is commercially viable. And that is why you attend all these gold medal, tak gold medal punya tempat ni. Right? Because you need your peers to say, or people from the industry to say your product. Because paling minimum, you will get their teguran. What is wrong with your product design? So you need that to improve, right? So, and then you need the opinion and approval from your scientific community. You have to publish. This is the problem. People will say, oh, I got product, I got gold medal. I don't publish the paper. Why? Because filing patent belum dapat. Poor excuse. So, tak ada paper because patent pending. Mana lawyer tak buat lagi. So, this is poor excuse. So, bottom line is that you need to publish so that you now have people who now say, yeah, what you're doing is right. It's on the right path. Nampak tak? Okay. So, essentially, when you look at patent in Malaysia, are we innovative? Okay, the answer is a big no. You tengok tak? In Malaysia, we spend 440 million, Thailand 300 whatever ni, but patent per 100,000 population, we have 1.7 per 100,000. You look at Korea, 456 per 100,000 population. That's why Korea is very innovative. Right? Everything they do, they can patent. But look at Japan. This is in 2003, 820 per 100,000 population. So they are very innovative in whatever they do. But the efficiency of patent, look at Malaysia, spending 259 million USD per patent. USD, bukan ringgit. Maknanya, our researcher buat research saja, tapi it doesn't go beyond that lah. So we spend money because the number of people who file for patent, that's why I said commercialization is only 5%. Sayang lah, right? And then South Korea is 26 million for per patent. Japan a bit more, but we have to learn from Korea how they can now be very efficient in getting the grant and then getting the patent out of the grant. So basically, if you look at Malaysia, we lack originality in performing R&D. And this is the iceberg phenomenon. This is what you see, the 5% that is with patent, right? You have to ask the question, why we have only 5%? With the university lecturer under tremendous pressure to publish, actually banyak benda you publish and you lost it. right? The word patent, as soon as you publish, is declaration public knowledge. Therefore, you lose the patent IP right. Dah, awal-awal lagi you lose, right? So the question is, are people aware about IPR? So, and then we need to encourage IPR awareness and patent culture. And this is the other problem. So not patent, but we should now not view patent as a number game. When you see university bila they file patent, they have to pay quite a lot of money. If that patent cannot get off the shelf, tak payahlah file lah. Buang duit ya. Right? So therefore, that's why in USM, when you there is a patent committee, which comprise of business people, lecturers, etc. When everybody who has the idea now come to the innovation office lah akan buat this particular panel, and then they will evaluate. And then if now the university kata, no, I don't want it, okay, then you have the right to patent yourself. If the university say, I will patent it, then the university is always the patent holder and you are the inventor. Faham? But as long as you get your salary from any FTA, it is you are always the inventor, which is good lah. And that's why I asked, where is the IP policy? To Dr. Marina, where is the IP policy? Because the IP policy will decide how much money that's given to the inventor. Selalunya, kalau sekarang ni 70-30, 70 to the inventor, 30 to the university, you will drive the innovation. But it's terbalik kot, 30 to the inventor, 70 to the university, no inventor will want to do this. Right? So that's why what is the innovation ecosystem is decided by the policy of that university. Right? Or even in some of the corporate, the whole work, whatever you do, totally belong to the corporate. It does not even, you don't even get inventor status. Lagi, nobody wants to do innovation. Of course, there's no benefit for doing that. Right? So these are the kind of things. If you patent, then make sure that it must be used to generate income, it's used to generate K-economy, etc., etc. So when you're ready to go through the commercialization gate, right, you must, when you're ready to do that, you must be able to convince the investor to believe in you in a 1-minute pitch. This is the problem, you know. 1-minute pitch is very important. You must be focused. And that is why in USM, we train you before you go to exhibition, because your mouth must say the right things. If you leave it to the lecturer, they will go their own way, inshallah you will fail. And that's why our innovation office under Professor Hanafi at USM will always train those who are going in. Kan, kalau 10 produk saja, my thinking is that all 10 must win award. If they win, they must win gold, not silver. So they are trained. What is the current scenario? What is wrong with the current scenario? You use the same thing to defend your product. And you must say in that order, not caca marba again. Ikut bila-bila you remember. No, you have to state it in that order. Then it is making sense for the judges to now actually hear you why you did what you did. If you zoom terus to the product, ladies and gentlemen, I have here with me this product called Inshallah, I have no idea why. You are showing me a solution. I don't even hear what is your problem statement. You see what I'm trying to say? That is the fault of lecturer who never win any award and then they come back upset. So people in RMC has a big job. They also need to train. If you are in the innovation office, lagi you need to train mulut their tongue, they have to say the right things. And the one who defend is the one who has to be trained. The problem is the lecturer malas, dia hantar graduate student dia waktu practice, then masa dia buat sendiri. No way. In USM, I will not allow that to happen. The one who practice in front of me is the one who goes in to defend to the judge. Because you have to learn. And you will see me defending, I will be talking to the wall to practice and rehearse until I get it right. That's how you get all the gold. There is already a formula, but you got to do it well, right? And there are things on the poster. When you do the poster, when you defend product, there's always a poster. There's always things. I'm talking to the judge as if I'm like me, but actually things on the poster is coming out as clues for me to guide, to go from one to the other, one to the other. The poster is designed to create the clues. Semua, that's how you get 100% gold. You see, the office has got to think about all this. It's not a matter of ambil berapa produk ada hari ni ya, kita hantar lah semua and then tengok berapa persen and then report to the director. Oh, today we got 20%. Oh, today we no, by design 100% or don't come back. That is RU status, right? But because then you get the student and the lecturer to learn something. It's not that their product is no good. They don't know how to defend. Usim, who has never won any of this, I put the same formula with the slide tadi, how to write the grant tadi. What is the current scenario? What's wrong with the current scenario? Go through step by step. Now Usim wins gold medals. Trust me, you use this, you will win. Right? But you can practice with the people who are the one who is defending. Right? So I say already, if the lecturer don't want to come, thank you very much. They are not defending that product. Because to bring a product to exhibition is expensive, especially from Penang to come to KL, where they have to stay, exhibition 1 minggu, right? Now tak ada apa lah MCO, thank God. But bottom line, before, you know, especially when the product has to go international, to Geneva, to Nuremberg, all those places, right? Because you cannot be jago kampung. There cannot be a product recognized only in Malaysia, and yet internationally it's not recognized. So what is gold in Malaysia will now go to international, and they better be getting a gold. Barulah produk tu you know it's a global player product. Otherwise it's a katak bawah tempurung product. So that is a guide to the university, whether university want to pump in more money or not in terms of patenting. How many more countries university want to cover, right? So this elevator pitch is very important, and in your research life, if you don't have a godfather or godmother, susah lah sikit. It's going to be a long and bumpy ride. But if the TNC or the VC or rector knows you, it's faster because they boleh tahu whether you boleh deliver ke tak boleh deliver. Right? Elevator pitch is also about that. What are they looking? Are they listening to you? No, they are looking at your eyes. Your eyes will reveal whether you are aggressive enough to want it to happen. Elevator pitch is subjective. It's subjective. Look at your body language. Look at the way you talk, right? Whether you will believe lah orang, alah aku tengok, and yeah. So that's it. That's enough to say no. After all, it's the venture cap punya money, not your money. So therefore, you have to be convincing, right? So, and once you undergo technology licensing with a spin-off company, you need to work closely with that company. So, I have a full picture of the USM on the front page of New Straits Times, but because I was not wearing a tudung, I had to cancel that last night. So you actually see only the one kat bawah ni lah. So when you undergo commercialization, I work with MTDC. Because MTDC, Malaysian Technology Development Corporation, was established to commercialize Malaysia's university punya R&D. So that is the time. And I worked for 8 years before the first patent and whatnot to come about. But as soon as you patent and you start the start-up company, all right, what is the name? Typhi.dot, I name it. Business plan, kita buat brochure, kita buat poster, kita buat design the kit, buat everything I did with my team, right? Because you cannot say, company, tolong buatlah benda-benda ni semua. The company has no idea what diagnostic is all about. They are business people. So you have to do all of these things. And a lot of the lecturers say, when you license, company lah buat. You buat macam tu, insyaAllah tak ada apa lah. So that's why you have to now be doing all these things together with the company, right? And but whatever it is, even to give talks on it or whatever I need to do right? But when I give the talk, I never talk about the price. I don't talk about discount. I don't talk. I'm here to talk on a scientific thing. You want to discuss with the company outside.
Sorry.
Your integrity must never be in it, because once public turn to you and you're talking about business and business plan and discount, the public will no longer believe in you as a science. They will see you now as a business person. That's not good. You want to sell the science, because in diagnostic, you have to sell in front of clinician, in front of all those people. You're talking about the science. They believe in the science, they will use the product. They don't believe in the science, they don't use the product. It's not about discounts. So discount, if they believe in the science, then they will go outside, they talk to the company. I don't deal with it. And I don't bawa people for dinner. Don't cross that line. Company bawa people for dinner. I don't bawa people for dinner. You understand what I'm trying to say? You must know where is your line when you now commercialize, right? And this is where I am, from scientist to technopreneur. Not entrepreneur, technopreneur, because I'm technology based, right? So you expect a long learning curve from the company. Obviously, they have no idea about diagnostic. And this kit, when it first started, is the first biodiagnostic industry in Malaysia. So nobody knows about biodiagnostic. You have to find where the bottles are. You have to buy, is it Ipoh, Perak, don't know where, who can make bottles that don't leak. Kan, diagnostic kit, they can have volume of buffers and whatnot. So you cannot find, you have to find bottles that don't leak, because when they're sending overseas, you have to find that. So, but we are, and the other one, expect skepticism of your product by your own peers in your own university. Because the guy next door, today, they are your friend. Tomorrow, when you commercialize, they can talk bad about you also. Jealous ke apa, wallahi. But bottom line is that skepticism always comes from your university among your friends. You gotta take it, right? And then we were unable to sell well in Malaysia because the number of typhoid cases in Malaysia is not high. So I need sales volume. So basically, this is where the company decided to go to Philippines, Indonesia, Pakistan, where the bigger typhoid cases are located. By doing that, Typhoid went global. Kadang-kadang is Tuhan atok lah, but I never even think, when I was developing the kit, it was meant by Malaysians for Malaysia. I didn't realize that in reality, it was not meant for Malaysia, it was meant for the world. Because the Malaysian market and the skepticism in Malaysia. But as soon as you go out to Philippines, Malaysia bagus. Right? Because this is a scientific R&D based product. Malaysia bagus for tourism. In science, we are not well known. In construction, yes, because we help in Madinah, Mekah, apa semua. But in science, in diagnostic, come on, why would I want to buy something from Malaysia? So there's a lot of science that has to be going through first before the ASEAN people believe in the science, right? So, and there is a need for continuous R&D. A lot of people think that when they do the product, finish. If you want to make the product Mark 1, Mark 2, Mark 3, Mark 4, you have to make the product to be technologically competitive. So you can now buat more fundamental to drive the applied, and it goes on to make it. Macam I kata lah, when I first, the whole scenario, it takes 5 days to produce typhoid result. I produce in 3 hours. So obviously people buy my kit. But now everybody is having the dipstick, you know, the one macam pregnancy test tu, that one can now produce in 15 minutes. I also have to change. So I changed this Typhi Rapid now is in the dipstick form. Okay. So in summary, this is what you need to do. All right. For pre-com, what are the market requirement, market study, technology foresight, the whole thing that I have just explained. Right. And when you want now to commercialize, this is the thing that you need to do when you commercialize. So it's just a summary so that you sort of have a checklist of what needs to be done when you are doing this by design. Okay. If you have done that, it's important that you do something for the university. If you can lah. So how now, whatever I have learned, more people need to learn. It's not about you alone getting all the awards. It's how do you bring others in the university, the young ones, those berminat, to also move sama macam you juga. So that you don't be the only diva, but there are other divas born more and more, right? So this is how I did. So we established the first translational institute. Okay, Translational Institute means Inform is driven to do fundamental and apply and create innovation to move into the global market, which is exactly what EPU wants, right? So I became the founding director, defended for an institute. So I don't want, Tan Sri Zul was the VC. He said to me, Asma, why don't you just take a center of excellence? I said, I don't want. I want an institute, which is 5 times more than a center. Punya agahnya saya. So therefore, and as soon as he gave me the institute status by Senate, I then say my next level is that I need to make Inform into a HICO in 5 years, because you cannot be HICO less than 5 years. So on the 5th year, Inform is a HICO, which makes more money, right? So it is the first multidisciplinary cluster-based research institute that is translational and given the HICO status to develop diagnostic technology platform for Malaysia. Following Ahmad Zuel, what did I do? Not just typhoid, I focus on all diseases relevant to Southeast Asia. This is what Inform does. So boleh pilih what are the diseases that I want, typhoid, cholera, semua ni national champion. Faham? So whoever did any of this diagnostic is actually a gold mine. So they follow the same template, macam saya juga lah, tapi buat sekarang ni on the different diseases. TB, you know, big deal, TB, right? So, and working again from Z to A. Everybody dalam Inform work like that, with this criteria, tapi in different diseases. Each disease is a business plan by itself, bring in different millions by itself. Faham? So that's how we are rich. Okay? Each is not one. Each disease is a different business plan, different amount of money, depending on typhoid. I mean, typhoid is only 41 million, but TB is huge. TB can bring in more money than typhoid. Okay? So, this is, ni you kena belajar. When you create anything, there is always a scientific discovery. You combine with a technology platform. Technology platform, as I say, when I first started up, 3 jam. Now it's 15 minutes. Now it's going to be 7 in 1, 3 in 1, no longer one test, one platform, you know. So now 3 different diseases in one test. So therefore, you patent separately the scientific discovery and the technology platform. Why? Because the scientific discovery can log in with any technology platform of the future. So you maintain your patent on the 50 kilodalton tadi lah, the scientific discovery. But the technology platform, you macam log in lah, log out, you know, so you can change the technology platform, whatever it is. But if you patent it together, it's gone. Once the 3 jam, you patent the scientific discovery and the technology platform for 3 hours, when I want to make it 15 minutes, it's gone. Faham tak? Because the whole patent was connected between the scientific discovery and the technology platform. So if you want to do properly, scientific discovery lain, technology platform lain. So in Inform, we have 2 group of people. People who do the fundamental to create the biomarker, and the people who do the technology. Ni yang nak design dipstick, nak buat sensor, nak buat thermostabilized PCR, nak buat PCR, different group of people. So that kalau Asma kena buat everything, gila nak keluar produk ni. Right? So therefore, in the institute, there are people who do the technology and there are people who do the fundamental. The fundamental can be cancer, can be TB, can be whatever. But they got the fundamental, they akan combine dengan mereka yang buat teknologi platform. Bukan semua, buat semua. Faham tak? So the technology platformnya group akan ni. So when we go in, that's how we create the innovation. We patent together lah. Apa masalahnya? Right? So, and once I do that, because we all use the same thing, the dipstick, ni kan? This dipstick test ni semua ni, this dipstick. Just put inside here, macam pregnancy test ya. So, by investing 240,000 inside Inform, all boleh keluarkan the test. This whole technology, we can create the dipstick in front of you on the fly. Siapa visit Inform, semua impressed. Because you can see the diagnostic kit being done right in front of you. kita chop, kita masuk dalam plastik, kita seal, jadi dah. The test is all done inside Inform. Right? So you can now invest in protein or we can invest in DNA. So we have a DNA platform lab, we have a protein platform lab. So anything yang keluar masuk platform, keluar dalam this format, dalam DNA keluar dalam this format. Alas. So as a result, we have now Mark 1, Mark 2, Mark 3. So for awards, there is one for Taifidot, Anugerah Akademik Negara, and then Profesor Datuk Rahmah, Profesor Rahmah juga menang for Rugia. Baru ni for Anugerah Akademik Negara bahagian pengkomersialan. So dua-dua dah menang Anugerah Akademik Negara. Okay, on Rugia. And these are all the other tests yang saya cakap tadi. Sebab tak? So it's easier to produce a lot of this diagnostic because they're using the same platform. That is strategy. Right? So that's how we create all these original discoveries and we can commercialize them all. Because any company who now works with Inform will now get all this because you cannot be a flagship of one. A company kena ada beberapa produk lagi coming in, right? So dengan ada teknologi macam ni, the company is assured because more product will come in from different disease, different market. But it's okay. They get more money. And we are okay also because we get more money also. So macam tu lah, right? So as a result, this is where after more than 20 publications, okay, for the kit, and these are where from Kubang Krian, Kelantan. This is the time when Taifidot was sold from Kubang Krian, Kelantan. Most of my students cannot speak English. They speak Kelantanese. So therefore, what I'm trying to say is that we can come from the Bundok area, doesn't matter. It's not about you must be in KL, you must be in Klang Valley to go to the global world. So this is proof that you can come from Kubang Krian, Kelantan and actually now go to the world. And the world is 18 countries that has received and used this particular more than 2-3 million people have already been diagnosed using the kit. 13 or 14 patents, of course, created the spin-off. And this is where I was a job creator before. For the selling of Taifidot around the world, we created more than 500 jobs. All right, and supported the local industry in Malaysia yang buat patent, yang buat bottle, yang buat kit, yang buat the boxes, you know, in the packaging, all that. And generated, of course, because Taifidot is sold in USD, of course, it created GDP Forex for the country, among the reasons why I won the award. And for Taifidot alone, I think more than 100 awards and more than 14 million grants obtained just for Taifidot alone. Okay, as I said, show me that it has created an impact to the community in Kelantan. When I first started out, these are the number of cases of typhoid, and you look at the highest in 2005. As soon as we have developed already by 1996, we developed, so we rapport with the state of Kelantan in 2005, and you see now the number of typhoid cases since we came in to help to diagnose, they dah jadi low. And now it's no longer a problem in Kelantan at all. So Kelantan no longer fight for being number one for typhoid every year now. So dah tak ada, there's no cases of typhoid in Kelantan. I mean very, very, very minimal if anything. So you see, this is because my diagnostic still continue, Inform still continue to help public health whenever there's an outbreak to bring down, because we can tell already where the, today, of course, we can develop for carrier detection. So we can tell who are the carriers and then bagi treatment to the carrier itself. Okay, so a lot of things I have not divulged everything. So this is why I come back to this. I showed this many times, but I hope you guys understand why now I say if you have the world with 6.7 billion or whatever, is very important. If we address the needs of the bottom billion, we will reduce the inequity divide and it will enhance accessibility. And this is very important. Whatever local solution we offer for Malaysia is also going to answer global problem. Come on, man. If you say only Pakistan, Bangladesh, if you turn the globe and look at South America, Latin America, they are in the same
level as us. The number of typhoid is also very high. Number of TB is very high. So by focusing, itulah kata yang Ahmad Zuel punya cakap, by focusing on what the West is not interested in, that means diseases of the poor, we suddenly have no competitor. So now with UIA, maybe you add one more, Sharia compliant, right? So that may be your competitive edge to enter into the Muslim world market. So this is what I'm saying. And then, of course, when I show you in Kelantan, to actually now real world experience to make sure that the impact is there. And that's how I use Tan Sri Zul selalu kata balance impact with impact factor. Mana impact factor papers balance that, balancing KPI and KIP, which will result hopefully in key result indicator, which is impact. Okay. So and because of the development of sustainable diagnostic, see when you buat all these things, it's not because you nak menang award tau. Nawai tu kena betul. When we first started out is to be able to reduce the inequity divide. That's why we use available, accessible, affordable. But somehow IDB picks it up. And basically Inform became another first for Inform to win the coveted science prize, which is USD 100,000. So I got that from King Abdullah before, so from IDB. Okay, so that is my awards separate, but bringing Inform with the rest to also now menang all the way to get the recognition. And of course, Inform is now a haiku. So basically what I want to end by saying, development of technology competitive product is no longer a luxury, it is a necessity. And R&I must be relevant and positioned to capture the Asian or the global market. And please go into blue ocean rather than red ocean. To boldly go where no one has gone before, that will be blue ocean, and offer local solution to solve global problem. Because as I said, the future is not about where we are going, but what we are creating. And for whatever that I show today, I would like to thank all the typhoid research cluster members at USM that has now managed to bring the product and whatever R&D to the level that it is today. So thank you very much. No, yeah, you have to come here. Or, yeah.
So Alhamdulillah, thank you Datuk for the very inspiring talk. Do we agree with that, right? We learned so much today, and I think all of those who are here today also can learn the tips that, like what Datuk was saying just now. When she first started, there was no clear path to do the commercialization, but she managed to do it. Okay, now she's teaching the basically the path, right, for all of us to learn. So there is no excuse for us to not attempt to do this.